This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar. This seminar is for educational.
Good afternoon, everyone, and thank you for joining us today for another HealthyU webinar. This webinar is Diabetes Management and Prevention. At any time during the presentation, please feel free to enter any questions you may have using the question and answer, the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Remember that all your questions will remain anonymous. Today's presenter is Mark Dublé, a registered dietitian with Mather Endocrinology, a practice of Harborview Medical Services. Mark is a registered dietitian nutritionist, certified diabetes educator, and a National Academy of Sports Medicine certified personal trainer who enjoys explaining the science of nutrition and exercise into the art of a healthy lifestyle. His experience in education spans a variety of settings from pediatrics to athletics. Mark is dedicated to improving the lives of people of all ages and diagnoses. Mark?
Hey everybody, I'm very excited to be here today, so thank you very much. Hopefully by the end of this, you'll have a better understanding of what diabetes is and how to treat it. So things to consider during today's presentation, some things that we're going to go into. First thing is, what is diabetes? That's probably one of the most common questions that we get. How common is it? What are the different types, because there are a few of them. The symptoms that may come across for those that are presented with the disease itself. What are the risk factors? How do I get tested for it? How can I prevent it or control it? And what parts of the body does diabetes actually affect? And more importantly, how can I educate myself in order to control it and get even more understanding of it? So what is diabetes? Diabetes is actually a chronic disease. It's characterized by high blood sugars. Another word for this is going to be glucose, and you're going to see that I'm going to use those two words back to back. It's very common for people to say, I have sugar in my blood. So blood glucose is a main source of energy, and it actually comes from two places. One of them, obviously, it's going to be coming from food, and then the second part is coming from the liver. So as you eat something, food becomes blood sugar, and then it can be stored in the liver for it to be released during the course of the day. In order for your body to absorb this blood sugar, your body makes a hormone called insulin, and this is coming from the pancreas itself. So this hormone, once it's released, it allows your body to absorb this blood sugar that's in your system and then used as energy. So when we talk about diabetes, sometimes your body may not produce enough of this insulin. It may not actually use it well, or it may not make it at all. So glucose ends up staying in the bloodstream. So how common is it? More common than most people believe. As of this year, 2020, 34 million people in the United States have this. This is a slight increase from previous tests that were done in 2015. So just over 1 in 10 people actually have diabetes. 1 of those 4 don't even know that they have it. Diabetes affects every 1 in 4 people over the age of 65. And most cases, and this is saying here, 90 to 95% of those cases are type 2 diabetes, and that's probably the most common one that you hear of. But there are 3 different types, right? So there's 3 different types of diabetes, and then a subcategory called pre-diabetes. So we have type 1 diabetes. This is 5% of those that are diagnosed. Type 2 diabetes, that's the 95% of people that have diabetes have this. And then there's a very small percentage, which is we're finding that is increasing. It's gestational diabetes, or diabetes while during pregnancy. So I'm going to start off with type 1. We're going to move to type 2. I'm going to go into gestational diabetes, and then we're going to end with what pre-diabetes is. So type 1 diabetes, your body actually makes no insulin. So in order to actually live, you need to be injecting insulin. So what's happening? The immune system during some point in the person's life starts to attack itself. It destroys all of the cells found in the pancreas in order to make insulin. So the body no longer can produce it. We're saying it used to be thought that it was only diagnosed in children of pre-puberty, but we're finding that it's happening at any time of a person's life. So in the teens up till 60s and 70s, somebody can be diagnosed with type 1. And again, so type 1 diabetes, your body makes no insulin at all, and you must take insulin in order to survive. So now type 2, this is the most common one. This is one that you'll hear a lot more people say, is that they've been diagnosed with type 2 diabetes. So with type 2, initially, the body still is making insulin. However, it may not be making enough, or it's actually being resistant to the insulin that's being made. This type of diabetes is found in any age, so it doesn't make a difference. You could be a small child, or you can be an adult. There is no age-specific time to get it. So people with type 2, they normally take pills. However, it's found more and more are having to take insulin even though their body is making it. Pills just may not treat the disease fully, so they do have to do insulin during the course of a day, just like a type 1 would do. And that doesn't make you a type 1 because you start having to take that insulin. So, and again, type 2 is the most common one. So gestational diabetes. So gestational diabetes, this type of diabetes is found only during pregnancy. So due to hormones that are being released during the pregnancy and throughout the pregnancy, in addition to the weight gain that goes along with it, we find that there is an increase blood sugars that happen during that time. Typically, it disappears once the baby is born. However, it does put you at great risk to have diabetes later in life, as well as for the child later in his or her life as well. So this is saying sometimes diabetes is diagnosed during pregnancy, but it's actually type 2. So if you never actually went to a physician or were getting your blood sugars checked periodically prior to pregnancy, you may have had diabetes prior. And now that you're pregnant and blood work is being done, it could have been found during that time. So pre-diabetes, I don't know if anybody has heard of anybody with this. Sometimes physicians may say you have a touch of blood sugar or a touch of sugar, but they never actually call it a name. This is pre-diabetes. So it's a condition that happens prior to, right? So it's an anticipation of. So it's not, blood sugars are not high enough to actually be diagnosed as diabetes. And I'm just going to give you an example. For somebody that's type 2, blood sugars need to reach over 127. With pre-diabetes, they're hovering just below that mark. So there isn't really a full diagnosis for it other than this name. It approximately happens to 88 million Americans. That's more than 1 in 3, quite more than being diagnosed as you've seen prior. 84% of those people don't even know that they have it. There are no real symptoms that may go along with it. Being pre-diabetic puts you at increased risk of type 2. Obviously, if it continues to progress, you're going to be diagnosed with type 2 diabetes, but it also increases risk of heart disease and stroke. The great thing with pre-diabetes, it's a warning sign. So when you're actually told about it, you can be doing things in order to decrease those risk factors that go along with it. The CDC has a program called the Diabetes Prevention Program, which we do have here at Mather Endocrinology. And it's a lifestyle modification that goes over diet and exercise in order to bring down those risk factors. So what are the symptoms? So the symptoms of type 1, type 2 diabetes, gestational, you may not find that you have any of these symptoms. So you're going to have increased thirst and urination. For a lot of people, this may be looked past, especially during the summer months. You know, obviously it's warm out. People are drinking and urinating more, but this is a big risk factor and probably one of the most common signs. Increased hunger. This is a very hard symptom to do. I'm hungry all day. That doesn't necessarily mean that I have diabetes, but it is a symptom more. So if you're having this uncontrollable feeling. Fatigue, being tired. So even if you're finding that you're getting enough sleep, this could also be a symptom. Blurred vision. So one day you were putting your glasses on or you didn't have glasses and all of a sudden you think that you may need them. Numbness and tingling in the hands and feet, probably very less common, but it is. Sores that do not heal. So even being a regular cut on your hand or your arm, if you're finding that it's been persistent for a long period of time. Unexplained weight loss. Most of the time, people think that they made a change or they're trying much harder with their diet, and then all of a sudden they had this 20-pound weight loss. This could be a symptom as well. So with type 1 diabetes, this symptom does happen quite fast. Within the course of a couple of weeks, somebody will have a drastic weight change. They'll be urinating quite often during the course of the night. With type 2 diabetes, this could happen slowly. It's a very slow progression. It can happen over months or even years. So the symptoms may not be that pronounced. Again, urinating 1 or 2 times during the course of the night may not seem like an alarm for some people. And for most people, they may not even have symptoms until they go to the doctor and they're diagnosed and they realize of them. So other risk factors. So what are the odds of me getting diabetes, or what are the odds of me becoming pre-diabetic? So genetics, this is very common for people to believe that genetics are a #1 contributor. It's very rare. You would need to have a genetic mutation that would happen for this to occur. Family history, this is very common. If your mom or dad has diabetes, or brother and sisters, you are more likely to have it at that time. Past medical history. If you've had a stroke, any heart disease, if you've been diagnosed with high cholesterol, high blood pressure, you definitely are more at risk. It's very common for people to have high cholesterol, then be diagnosed with high blood pressure, and finally to have be found out that they have high blood sugars as well. As soon as you hit 45, your risk factors definitely increase. Ethnicity, African American, Alaska, if you're Native American, as well as Hispanic or Latino, Hawaiian or Pacific Islander, you have much higher risk factors of getting diabetes. Lifestyle. So if you enjoy your alcohol, smoking, if you have poor sleep habits, you can definitely decrease risk by reducing all those things. Nutrition is a huge part of diabetes. So making sure that you're not overeating or binge eating, maintaining a proper healthy diet definitely will help. Activity. We all know that we need to be active. 30 minutes is what's suggested. If you're not getting that in, you're increasing your risks. And your weight, a body mass index over 25, you have higher risk factors of getting diabetes as well. So how do you get tested? So being diagnosed would have to be through blood. So if you find that you've had any of those symptoms, as we were discussing before, increased urine, thirst, hunger, fatigue, or anything for that matter, You would just speak with your primary doctor and just let them know, hey, I've been having these things, or I have a history of diabetes in my family. Is there any way for me to be proactive about this and get tested? And there is. So periodic blood work, so a complete metabolic panel or basic metabolic panel is something that they should be doing yearly on you. What would be found on there is called a fasting blood sugar. So not eating anything prior to a blood work, at least 8 hours. If that level is elevated, they may want to do further tests. One of those tests would be a hemoglobin A1C, or a shortened version, just a A1C. This test is an average blood sugar over the course of 3 months. So it's not just a snapshot like that fasting blood sugar. It's going to give us a much wider picture. A random blood sugar, they could just say, hey, you know what, if you're already having symptoms, why don't we just take a blood sugar right here and then in the office? If it's above the recommended range, they could diagnose you there. Or they can send you for what's called as a glucose tolerance test. Now this test is an actual, you'd be given sugar water, and they would be testing your blood sugar at that point prior to you drinking it, and then periodically over the next couple of hours. This is very commonly done for gestational diabetes. So at 26 weeks, all women are usually tested for gestational, and this is the test that they perform. So what are the levels? Now, you may not necessarily need to know this, but I thought it was a good, as a good idea for what you would, so you can just get a base idea of what we're talking about here. So for somebody without diabetes, with normal blood sugars can range, anywhere from, believe it or not, in the 60s up to about 100 or 99. So at any given point of the day, your body is ping-ponging your blood sugars throughout the entire day, depending on how active you are, what you're eating, and whatever else you might be doing. So blood sugars normally will not reach above 100. If you had a glucose tolerance test, they may reach slightly above that level, so a 139, but they'll be sure to come down quite fast. With pre-diabetes, blood sugars would range anywhere between 100 and 125. So if we were to look at what an A1C would be, that would be above a 5.7. So back to that normal blood sugar range. An A1C is again an estimate of over 3 months, an average. And so blood sugars would be between that 100 and 125, or an A1C between that 5.7 or to a 6.4. Now, in order to be diagnosed with diabetes, you technically need to have 2 positive tests. So that could be an A1C above a 6.5. You could be having a fasting blood sugar above a 126, a random blood sugar of 200, or any of those oral glucose tolerance tests of 200 or above. So now, how do I prevent it? Or if I was already diagnosed, how do I control it? So this is something that definitely should be discussed with your healthcare team. This involves more than one person, not just your physician. He's going to have a tremendous amount of other people. He or she will have a tremendous amount of other people helping you with this. So if it's their nurse practitioner, if it's a diabetes educator, or a dietitian that might be on staff, or even a nurse, all of these people would help to choreograph a plan for your care. So some of these simple steps that they would be doing: 1, they're going to monitor your ABCs. What is this? So ABC stands for hemoglobin A1C, your blood pressure, and as well as your cholesterol. And now they're saying that S stands for blood sugar as well. So A1C, blood pressure, and cholesterol, they're going to be monitoring. You'd actually meet with a registered dietitian, try to make sure that the diet that you're currently following is in your benefit. Of course, we need to live realistically, but the question is how much, right? Making physical activity part of your life. So getting in at least the 30 minutes a day of planned activity. Yes, being active during the day, like going food shopping or cutting the lawn, are all very great things to do, but specifically planning 30 minutes of getting outside, walking, or something similar to that is extremely important. If you're already taking medicine, be it for blood pressure or cholesterol, definitely sticking to it. If your physician felt that taking other medications would help also decrease your risks, being consistent with those. If you're already diabetic, checking your blood sugars every day. This is going to allow your team to navigate a better direction for you, because taking blood work periodically every couple of months is too long of a period of time, but being able to monitor and see these blood sugars on a day-to-day basis is a huge help. Something that's always looked over, dental and eye care. These can actually be big predictors of diabetes or elevated blood sugars for somebody. So if you're not taking care of your teeth, or you're finding there's a decreased health in your oral, that could be a big sign of diabetes. And same thing with eye exams. Your ophthalmologist can see if there's any increased blood sugars just by looking inside your eye. So making sure that they're healthy is very important. And lastly, just coping in healthy ways. If you've been diagnosed already, it can be a big stress on your shoulders. So making sure that you have somebody to talk to is extremely important. So what parts of the body does diabetes affect? So like we mentioned before, you're at increased risk of heart disease and stroke. And so it happens back to back. If you already have heart disease, you're at increased risk of diabetes. And if you have diabetes, you're at increased risk of heart disease and stroke. Neuropathy. So diabetes affects all of our nerve endings. So what that's called is neuropathy. So if you've ever heard of tingling or numbness in the hands or the feet, this is decreased circulation to those areas. This usually occurs over the course of 5 to 10 years after diagnosis. Nephropathy. So nephropathy is the decreased function of your kidneys. So a lot of people ask, why does this happen? Why would the decreased function of my kidneys happen from elevated blood sugars? But I always like to use an example of a Wendy's milkshake. I don't know if you can envision that. Trying to suck that through a straw is very difficult because of the thickness of it. So blood sugars actually happen the same way. As blood sugar increases in your bloodstream, it becomes thick, and the kidneys themselves have very, very small veins in it. And so you can imagine that thick blood putting a lot of pressure on those kidneys. So if you don't have controlled blood sugars, it's going to be putting a tremendous amount of pressure on that area. Retinopathy, this is blindness. We've all heard it. People have diabetes, they go blind. This is a serious condition. And again, this also happens over the course of a couple of years of being diagnosed if it is uncontrolled. So definitely seeing your eye doctor. Gum disease, as I mentioned before, if you have a lot of sugar in your blood, that increases your risk of infection, as well as bone loss and increased risk of cavities in the mouth. So sexual dysfunction and as well as bladder dysfunction. These are two things that are not always talked about, but having high blood sugars increases your risk for both of these factors. Depression. It's very common for people with diabetes to become depressed. Now, is it due to increased blood sugars directly, or is it the stress of the disease and having to manage it every day? Regardless, it does increase your risk factors of having depression. So as mentioned before, having a plan with your team in terms of talking to somebody or ways to release that stress is very important. Memory loss. High blood sugars have been linked to dementia. So if you've had dementia in your family and now you have diabetes, you've increased your risks greatly with both of those diseases. Sleep apnea, it's found that with high blood sugars, you actually have increased risk factors of getting more poor sleep. And with that, sleep apnea is unable to get that full oxygen as you're sleeping, and so they go hand in hand. So you can see that there is a tremendous amount of things that happen from the diabetes alone. So how could I educate myself? So educating, I always say go with trusted and reputable reputable sites. You know, the internet is full with a lot of information, and you know, with diabetes, it could be like the game of telephone. You're reading something here, or somebody is saying something, and it ends up trickling down into a whole new information which may be untrue. So definitely try to go with sites that are going to be informative and real. So the American Diabetes Association, I have that at the top of my list. They always have current information of what's available, everything from recipes to exercising to information in regards to medications that you might be on or the physician may want to put you on. The American Association of Diabetes Educators, this is a great site. It simplifies things. It allows people to read and understand diabetes very clearly. The National Institute, if you're looking for something that's going to be a step above or something that's going to be very clinical, the National Institute of Diabetes, Digestive and Kidney Disease has great information. Of course, the CDC. And Johns Hopkins has a great site. It has handouts and take-home materials that can be printed. So definitely give them a check out as well. And of course, you know, speaking with your physician and or a diabetes educator or somebody that specializes in it would be a great start as well. So Beating Diabetes program, anybody that has been diagnosed with diabetes, we do have a program that's going to be starting up in January, and enrollment is open right now. So you can feel free to call our office. You can get in touch with me directly, or you can email me. My email is found at the bottom of the site here, and that should be able to put you right in touch with me, and we'll gather your information and see that you get into that class. It's a 7-week program. We meet once a week for 1 hour. It's incredible. So I want to say thank you to everybody, and thank you, Stu and Mather, for allowing me to be involved. And I think that we're going to open this up to questions at this point.
Great. Thank you, Mark. A lot of good information there. Again, if anyone has any questions, you can enter them in the Q&A feature, which is found at the bottom of your screen. All questions are anonymous to protect your privacy. And I believe we have a couple of questions already. First question, I've read that some foods can actually lower blood sugar, such as Metamucil and cinnamon. Is that true? Also, are there any receipt books you can recommend so I can plan appropriate meals for weeks at a time?
Great question. So Metamucil and cinnamon. So both of these items are actually high in fiber content. So there are some studies that taking Metamucil prior to a meal will actually satisfy you or keep you full or fill you up sooner during the course of the meal. So you probably will end up eating less. And that's the whole concept behind fiber itself. We encourage high fiber foods like your vegetables at each meal. That way you do end up eating a little bit less of everything else that might increase blood sugars. Along with that, you get a tremendous amount of nutrients like vitamins and minerals. Cinnamon itself has been found. There are some studies that taking cinnamon, either adding it to your foods, may help with decreasing blood sugar. If you've already been found with diabetes, of course, this is something that you would really want to discuss with your physician and see if there's any effects with it. Any recipe books that you can recommend? Absolutely. So what is it? Cooking Light. Cooking Light magazine has a tremendous amount of recipes. I love a lot of their things because it's real foods, and the best thing about it is that you can still eat them. So they use a lot of measurements and choosing healthier options to allow you to really still live your life. So that's something I would go with. And the American Diabetes puts out a tremendous amount of cookbooks, which you can find probably at your library or even at like somewhere like Barnes & Noble or a similar bookstore.
And another question, is diabetes named after someone, and how far back does its recognition go?
Right, really tested me here. So diabetes mellitus or mellitus is a scientific name. You could be definitely right. I can't recall right now if it's actually named after a person, but how far does it go back? Quite a bit, to the point where at one point when diabetes was first diagnosed, they were trying to control it with what is something similar that we do now, is reducing carbohydrates or a low calorie diet, until they actually found that injecting somebody with pig insulin or an animal insulin was really the better way of treating it and keeping it controlled.
A couple of questions here about the program, the Beating Diabetes program. First, is there a cost? Is the program a nutritional program, and can it be planned for the individual? And will the program be virtual?
So the plan is virtual. It's 100% virtual. As mentioned before, it is a 7-week program. It's for 1 hour. It's at 5:30. So it's a 5:30 to 6:30 on, I believe it's Tuesdays. The cost, there is no cost associated with it. We do go through insurance with it. So there would have to be an authorization that would be done prior to it, or an investigation of the insurance. The other question was the program a nutritional program? So nutrition is one aspect of it. We definitely will be going through nutrition, how to eat, what to eat, and things similar to that, as well as activity and just anything that you could possibly think of to help better control it or give you better outcomes.
Another question, does exercise increase the effectiveness of daily insulin?
100%. So exercise is one of the most effective ways to help control your blood sugars. Of course, besides diet and as well as insulin itself if needed. But if you can imagine your muscles as a sponge, when you're being active and you're moving, your muscles actually have to suck up all that blood sugar that's in your bloodstream in order to produce energy. So the more that you're using your muscles, the more that they're going to absorb that blood sugar. And to be quite honest, it's actually one of the few things you can do without insulin being needed. So activity allows your muscles to absorb that blood sugar without insulin having to be in play.
And a related question, is there a better time, morning, midday, night for exercise, and before or after meals?
Excellent question. The best time to do exercise is when you can get it done. That's it.
Great. Someone is asking, what color should your urine be for an A1C of 5.9 and a fasting glucose of 93?
So urine is probably not a great indicator of how high your blood sugars are. However, you will find when blood sugars are at a higher level and they have to be probably over 180 to 200, and at that point you're way too high, you may find you have darkening of the urine. But darkening of the urine can also indicate a number of different things, dehydration being the simplest thing, and then of course other factors that may come into play like kidney health. So that may not be always the best thing to look at, but keeping hydrated with or without diabetes is extremely important.
Okay, 2 questions here, both related to weight loss. Someone I know has had diabetes for 15 years, was switched to a new medication which caused rapid weight loss. What is a safe way to gain weight back without there being a drastically negative effect on blood sugar?
That's a very good question. So there is a correlation between weight and diabetes. So we do find as weight is going up, you're going to have more insulin resistance, obviously, because you have more volume to the body. So the body has to produce more insulin in order to maintain better blood sugar control. So if the person's able to maintain an appropriate weight for their height, and you're going to have to talk to your physician to find out what that is, or just a simple 5% decrease in weight, we do find that blood sugars are drastically improved. Now, how do you gain weight but still have better blood sugar control? It's very tough. It's a very fine line with that. For anybody, I would first ask your question, where should I be? What should I be weighing at this point? Because we all have different perspectives of what we believe our weight should be or how we like to see ourselves at a certain weight versus what we really need to be at. So I never really encourage weight gain when we're talking about diabetes unless you are physically underweight, because as you increase weight, blood sugars most likely would go up. So you need to talk to your physician about managing medications if that's in your plan.
And a related question, can weight loss alone reverse the diabetes diagnosis?
We've seen time and time again, especially in our diabetes prevention program, As mentioned before, just a simple 5% of body weight can drastically change blood sugars in a good way. So we have seen people come off of medications with weight loss, if that is an option. Again, you know, going back to those diagnoses, a type 1 versus type 2, and if your body is producing enough insulin, that really is the dictator if you can be off of meds. But losing weight definitely has been shown to help reverse it, or I should say keep it at bay, and keep people off or with limited amount of meds.
Okay, another attendee is asking, I receive a lot of emails regarding the dangers of taking metformin. How safe is it?
That's a great question, and something that we do get here very common. So metformin has been around for many years. It's probably one of the grandfather drugs that has been shown to decrease blood sugars without weight gain. And to go back to that other question, when you see weight gain, you know, blood sugars do, there's a discrepancy. So with, as opposed to some other medications that help with blood sugar control, sometimes they can make you gain weight too. So that's kind of counterproductive, right? So blood is medicine that will decrease blood sugars, but then make you gain weight. Metformin has been shown to decrease weight and decrease blood sugars. Right now, what we're hearing is there's some risks of cancers because of some materials that have been found in some of the people that are producing these medicines. So that is not fully related to the medication itself. That has to just do with some products that were found in there. But metformin overall is a very safe medication.
Another attendee writes, my A1C came back 6.4. How difficult is it to lower that number?
That's a question you have to ask. We have to ask ourselves, right? So a 6.4, you're really at the cusp, right? So 1 more percent, you're considered to be diabetic. Right now at a 6.4, that person is considered to be pre-diabetic. So this is a great opportunity to really dig deep and ask yourself, do I have room in my diet to change? Are there things that I can be making improvements of? Am I finding that I'm getting in that 30 minutes of activity a day? So with both of those, you know, is there change that's available? So you may want to speak with your physician, see if there's any other options if you believe that you're doing both of those, or joining one of the CDC programs, that's the DPP, that's the Diabetes Prevention Program, where you may be able to go through your diet, or seeing a dietitian, go through your diet, going through exercise in order to help decrease those risks.
I've been diagnosed with pre-diabetes for many years. Will I be a candidate for the program? I assume she means the Beating Diabetes program.
So the Beating Diabetes program is geared for those that have already been diagnosed. However, there is a separate program. It is called the Diabetes Prevention Program. If you have pre-diabetes, or anybody that has pre-diabetes, that is definitely the program to join. As mentioned before, this is going to focus more on lifestyle changes, diet and exercise. Our Beating Diabetes program is going to go through finger testing, medications, along with nutrition and activity. So there is a little bit of a difference between the two.
Another attendee asks, why do you say blood sugars, plural? I thought it was just blood sugar.
That is a good question. It is just blood sugar. I'm saying it plural maybe because of the fact that blood sugars change every second of the day. So thank you for correcting me with that.
How can it be determined that one is reversing diabetes if they're still on medication?
So is the diabetes then really reversed, or is it being controlled at that point? I think if you're still on medications, you are controlling it. And for most clinicians, they won't say that you can reverse it, but you can put it at bay, so you can definitely control it. Diabetes is something that never really disappears. You're always going to be at risk for it, even off of medications, unfortunately. It always has the chance to sneak up on us if we lose sight in focusing on being healthy.
Okay, Mark, someone is asking, when looking at food values, should I limit total carbohydrates or the percentage of sugar?
That's a very good question. So I'm going to start with focusing on total carbohydrates it's a complicated question. So overall, diabetes is the inability to or metabolize food, right? So overall, so no matter what you're eating, food can affect your blood sugar. We focus specifically on carbohydrates because of the fact that they spike blood sugars the fastest. So carbs are only one picture of actually the whole puzzle. And with our American diet, a lot of our foods are composed of carbohydrates. So we do focus on total amount. So total amount of carbs is really the first thing you want to look at. Then looking at total sugars or decreasing the amount of sugar of that food is going to make it that much better. So I'm going to just give you an example. If I was choosing a cereal, all cereals are carbohydrates. There's no going around it. You can't decrease the carbohydrate content only by decreasing the actual serving size. But what you can do is you're able to look below total carbs and look at sugar content and fiber content. And what you want to do is you want to try to choose a cereal that has lower sugar content and higher fiber content. A number that we usually shoot for is under 3 grams of sugar is always a better choice, and above 5 grams of fiber is always a great choice. Now, again, total carbohydrates is what you're looking at. So just because you go with a no sugar food or a low sugar food doesn't mean it won't affect your blood sugar. It's the total amount that you really want to focus on, in addition to total sugars.
Okay, a few related questions from the same attendee. She says, I have type 1 diabetes. Will I qualify for the Beating Diabetes program?
Absolutely. We would, I would say just either you can email me or contact our office directly, and we'll be sure to get your information.
Okay, and I think I've hit them all. What if my fasting sugar is high and completely normal after a meal? Is it anything to worry about?
That's something that I would definitely speak with your physician about. If you're finding that you have blood sugars above 100, if you have never been diagnosed with diabetes, that's something that you would want to talk to them about.
Okay, well, everyone, thank you very much. Mark, thank you for an excellent presentation. If you think up a question afterwards that you weren't able to ask, you can send it to matherhospital@northwell.edu, and we will pass your questions along to Mark. Once you exit the webinar, you'll see a link to a brief survey. If you could please complete that. Your feedback is extremely important to us and helps us plan future programs. Thank you all for joining today's webinar. If you would like to view other HealthyU webinars we have presented or find this one posted, you can find them at www.matherhospital.org/HealthyU, healthy with the letter U. Again, thank you all for attending, and Mark, thank you very much for the presentation.
Thank you, Stu. Thank you, everybody.